Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today you wanted to cover how to stop knee pain with bicycling.
Absolutely, because it is one of the problems with bicycling. Back pain, knee pain are probably the more common issues that come across with cycling.
It's interesting you say this, Brad, because I just started biking the other day again.
Sure.
It was nice out, and I started to feel a little bit of pain on the outside of my knee. And luckily I knew what to do, but
Right.
I think we'll kind of allude to this later on.
Otherwise, you could wait and watch this video and then figure it out.
All right, well, I could do that too. And by the way, if you're new to our channel, please take a second to subscribe to us. We got a subscription button over here or down here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
Excellent.
All right, Brad, what's the first thing you want to do to stop knee pain?
Well, it doesn't matter what kind of bike you have. Everything we're going to talk about refers to mountain biking, a road bike like this, or a cross trainer. You're all sitting in the seat, you're pedaling, the knee's doing the same action. So the thing is about people say, well, we should bike. No impact, it's going to be good on our joints. That's not exactly true, because there is repetitive motion.
Right.
And if things are not lined up properly and you do that repetitive motion over and over and things are grinding or not, misaligned, it's going to cause problems.
Yeah, it is.
Yeah.
It's just repetitive motion injury type thing.
Exactly. So
what's the first thing we should cover, Brad?
By far the biggest thing for the knees, in my opinion, is the height of the seat. Make sure you got the seat the proper height. In my opinion, and from the people I've talked to who know about more about this than I do, the seat in most people's cases is too low.
Right, and I see that all the time.
Yeah.
We were just talking about this. I saw a guy in our neighborhood who's just pedaling around like a clown, and I mean, he's going to get knee pain.
Right.
So.
And so let's get right to it. You need to get on your bike. If you don't have a trainer like this to hold your bike up, you're going to have someone hold the bike up, because you need to get on the seat. And it's really helpful to have a trainer so you can spin around a little bit, get your seat bottom on the seat where it belongs, where you wouldn't naturally have it when you drive or ride, I mean. Get your foot parallel to the floor. The bike should be parallel to the floor.
This part should be parallel to the floor.
Right. So we're not going to be pointing down like this or in the opposite direction with the knee closer to the floor. Parallel there, and go to the bottom dead center, 6 o'clock I call that, like if you reference to a clock. And go ahead, Bob.
Well, you're going to have a slight bend is what you're going to have,
Exactly what you want.
So you're at about a 13 today?
Yep.
Lucky 13, Brad.
Right. And from the information I've got from the experts, 9 to 14 degrees is what's recommended.
You barely made it, Brad.
Right, yeah, so I'm in there. If the seat's too tall, you're going to find yourself reaching down for that pedal, and that may be more harder on your back than your knee. If you're too low, and every time you come around, your knee gets about this far, and that's as straight as it gets, it's really hard on the patella, the kneecap. And it's going to give you a more increased risk of arthritis as you get older. This is one of those things you may not notice it that summer that you're riding, but years down the road, it catches up with you.
And patellofemoral syndrome, too.
Exactly. We're going to talk about some exercises on how to take care of that.
You want to use your plumb line, too, Brad?
Yeah. The next thing is make sure the seat is forward and backwards in the proper direction.
If you have that adjustment.
Right. A typical cross trainer may not. Any road bike or a mountain bike typically does. The adjustments under here, you can move the seat forward and backward a few centimeters. Put the pedal at the 3 o'clock position. That would be 12. That would be 3, or it could be 9, depending on which way you're looking at it. Doesn't matter. And then you take a plumb line. I'm going to hold this. This is a lot easier to see on the camera. Directly below the end of the patella, you're going to go down. We're going to look at this edge of the line. It should line up with the axle of the pedal or your MTP joints right through here. Where your toes connect to your foot.
This one is going in front of the knee?
Right. You can go in front of the knee. Actually, it should be 1 to 2 centimeters in front of that axle line.
Okay.
This, I'm not going to spend a lot of time on getting real accurate with for this particular video, but if you're way out here and you're hanging in front of your toes, you've got to get that seat back a little bit.
Yeah.
Okay.
Again, that's the whole thing, is you don't want that knee in front of the toes, just like when we do squats and everything else.
Right.
You want to have it
Exactly. It's that same concept. So make sure your seat is in the right position, forward and backwards. Up and down is by far more important. The other thing, if you have a pedal that has flats or you're not clipped in to the pedals, then you don't have to think about this. But if you do, if you got clipless pedals, or if you happen to have stirrups, mostly it's clipless, there's some adjustments on those. Like on this, I had mine tight, and the guy who set me up with it at a bike shop, he made my feet point straight ahead so it looked anatomically correct. Well, my body doesn't work that way. My toes point out naturally.
Brad tends to walk out like this a little bit.
Yeah, maybe even a lot of bit. And so he did that. I'm riding my bike with my feet all nice and lined up the way it's pretty, so it looked good, but I could feel it in my knees pretty quickly, actually. So I loosened those up, and my toes do point out a little bit when I ride, but I feel better, and that's the way it works. So
that's how you're built anatomically.
exactly. So that may make an effect on your knee, having too tight, or I was reading even if it's too loose, which I haven't quite figured that out yet, but I could see if it's too loose, maybe things are moving too much. But keep that in mind, making adjustments on the clipless pedals. Now, this other one is probably one of the biggest things, and it doesn't matter how you have your bike adjusted. It's the old saying, too much, too soon.
Right.
You just buy a bike, you haven't biked before, and you go out and you ride 20 miles, put a few hills in there, you put some good stress on your knees, and you get off and you can't walk, and the next day your knees are swollen up and painful, and then you decide not to go biking anymore because it's hard on your knees. You know, start out reasonable.
Start off, yeah, exactly.
Yep.
Slow and build up slow.
Exactly, a few miles at a time. If you're an experienced biker, you know what I'm talking about. Now let's talk about
some of the injuries that could happen. Okay.
Probably one of the big things is the kneecap. If the kneecap or patella is not tracking in the femoral groove, we call it, well, that can cause problems. And you'll feel it while you're biking, or maybe the next day, or even years down the road. So we're going to talk about if you feel pain in the knees, you got everything adjusted right, and you're still feeling knee pain when you're riding. And should we go through the taping?
Yeah, let's go through the taping.
Easy way you can do this to determine if it is the kneecap not tracking properly.
Actually, Brad, if you want to bring that stool over.
You bet.
So, again, this kneecap, it actually moves up and down when you bend and straighten your knee.
Right.
And it's going along in a groove. And a lot of times what happens is the kneecap is drifting too far that way.
Right. So it's lateral or to the outside.
It's too far this way. So what we do as a test to see if this helps your knee pain is we actually take, usually we put some underlying tape down first because this is really hard on the skin. But just for instructional purposes, we won't. But what I do is we actually, the leg has got to be really relaxed because you're going to be able to move the kneecap. And I'm pushing it over here. So you actually take the piece of tape, put it on the edge here of the kneecap, and you push it over, and then you tape it in place.
Right. So you can see, if you can zoom in on this line, I don't know if you can see it, but the skin is wrinkling. We're actually pulling the patella slightly over towards the inside. Now,
and usually I'll do two pieces right away. I'll do it again. I'll put it on there and I'll pull it over and do it again.
Now, if you're at home, you could just go to the pharmacy and buy some athletic tape and do this.
Yeah, and give it a try, and then go ahead and bike with it like this, and see if it makes it better.
Exactly. So if you go bike a mile, you got some knee pain, you feel it in the front of the knee, get off, and make sure it's not sweating so the tape sticks. Put the tape on, pulling it over, and go ride the exact same route. And if you feel an obvious difference, it feels better because of the tape is on there, it's pretty clear you've got a tracking problem.
And one of the things you can do for treatment, Brad, for that, I'm just thinking of this right now, is actually you can stretch that kneecap. I mean, you can work on pushing it over here and stretch it this way. We actually even stretch it down this way and up this way. They stretch it in all directions.
Right. We call that patellar mobs.
Yeah, and you can just push on yourself if it doesn't give you the creeps.
Right. Now, like if you're doing this at home and you go like this and you try to do it,
it's not going to work.
Your kneecap is locked and you have to have it up on something. And now my kneecaps, the quads are loose, as relaxed as they can be, and then you can really get that kneecap to move around, and then you can do those mobs on it. These mobs should not create any sharp pain at all. It should be just a stretching, a gentle stretch type feeling.
I'm going to show one strengthening for for patellofemoral syndrome too. It helps to strengthen the external rotators, believe it or not, of the hip.
Okay.
And I'm not going to go into why that works, but let's say this is the knee, Brad, because I don't want to lay on my microphone.
Sure.
So you're just going to do clamshells.
Yep.
Like this. And you can do, you could actually do it with TheraBand or resistance band too if you want to make it harder. But actually, if you do quite a few of these, Brad.
Sure. Here, let's give this a try just in case. Give me some room, Bob. There. But yeah, Bob was saying you don't even need to have resistance a lot of times.
Especially to start. I'll bet you do 3 sets of 15 on this,
Yeah.
it's going to be burning.
But,
so,
you know, we've got some guys out there that are pedaling 100 miles an hour.
Yeah, that's
They're
right.
going to need some resistance,
but
Bob.
they might be surprised how weak their hip is.
Sure.
So,
Yep.
the other culprit quite often is the IT band, isn't it, Brad?
Right, exactly. That the band that goes from connects just below the knee all the way up to the TFL and into the pelvis.
Tensor fasciolata. And what you get is it's called IT band friction syndrome.
Sure.
And that's if you're getting pain on the outside of your knee.
Yep.
And so if you're getting that, and it makes sense because your band is tight and it's just constantly, repetition here, you're going to want to stretch that IT band.
That band has got to get stretched out so you can gain that flexibility and take the pressure off of that.
So you want to show, well, yeah, foam roller is a great way to stretch it, isn't it? You want to go ahead and do it, Brad?
If you're going to use this technique on a foam roller, I recommend the low density one.
Right.
If you get the high density one, the black ones, it's pretty aggressive. So you're going to go like this, so you're supporting here with this hand, and you're going to roll right across that IT band.
And I'd really work up on the tensor fasciolata area here too, and even the glute max attaches into the IT band. So you want to really work those muscles because that's the part that's really stretching. I don't know how much the IT band even stretches, but I think if you foam roller the IT band, it pulls on those muscles and stretches them out,
exactly. And you can spend 5 minutes on doing that if you'd like to, 2 to 3, depending on how it feels and how tall.
So those are probably the 2 most common things, the IT band and the patellofemoral. So hopefully that has helped. Thanks a lot.
Have fun biking, less knee pain.